Well, in about 2010, we sent a team up to Seattle to get trained in team steps at the University of Washington. And it became very clear to me that patient safety really sort of belongs in the relationship of the caregivers, the relationship of each other as a team, the relationship to each other. And so I got very passionate about how team training would improve patient safety. And initially at Stanford Valley Care, we did some training and simulation with massive transfusion protocols. We started primarily in the OB unit. When I transitioned to the Chief Medical Officer role at St. Charles in Oregon, we took that training there and introduced it in that system. And my team from Valley came up there, and then I continued to teach at Stanford Valley Care. So I strongly believe that patient safety is improved through team training and team dynamics of the caregivers. There's always, when you introduce change into the clinical environment, there's always resistance. And in the physician community, there can be stronger resistance because they might see team training or any new dynamic as a threat to their autonomy or their authority. So sometimes physicians are hard to bring into team training. Once they come, they find it to usually be enjoyable and also helpful. The staff really gets engaged when you introduce simulation with the team steps didactic. They enjoy the simulation, they enjoy getting better. When you roll out team steps, and then more importantly sustain it, you need the administration and leadership to be bought into the concept. But also leadership has to mirror what you're teaching, and they have to inquire and celebrate what you're teaching. So you have to have the leadership and administration bought in for any type of sustainment of a safety program that involves team steps. But more importantly, you have to have a core group of trainers. Team steps can call them master trainers that really support one another through that long sustainment effort. You've also got to find a few physician champions. If your key members of teams aren't involved in your training or your simulations, it doesn't have that same adrenaline. So you have to find some physician champions. I think for us, we'd like to help organizations form that key group of 5 to 10 people that can keep it sustained at the organization. Having people visit or intermittently roll out team steps concepts will not help you sustain it. Gina and I are really looking forward to helping build teams within organizations and giving them some lessons that we've learned over the last 7 years.